let me talk to you about something that may be a word or term you'll find online, which is called bioesthetic dentistry. Bioesthetic dentistry is actually a very select group of very highly trained professionals. There are only a few hundred in the world that are trained in this biological approach to care. So you can't spell biologic without logic, and you can't get bioaesthetic without biology. What biological, bioaesthetic, what logical and straightforward dentistry is simply just finding out what works and applying that. So I always loved tracing when I was a kid. I could never draw, but I could trace because I could take the beautiful work of someone else and I could copy it. And so I never thought that that would be something I'd use in the future, but that's exactly what we do in bioesthetic dentistry. You see, bioesthetic dentistry started on the foundation of a biologist who was actually a biologist before they were a dentist. And they studied hundreds of animals, deer, tigers, dogs. And what they found out was that if you line up 10 German Shepherds, all their teeth look the same. If you line up 10 giraffes, all their teeth look the same. If you line up 10 humans, none of their teeth look the same. So why is it that you see this pattern? This is such a strange pattern. We're just mammals and animals just like they are. Why is it that all of them look the same and their teeth look the same? And how come our teeth look so different? And even if you line up 10 people of the same demographic, their teeth look different. So something must be off here. So they studied and they started to collect data on the people that they actually saw had similarities. And they took information and data on their chewing system and their bite, their jaw joints, their airway, and they looked at the commonalities. And they studied dentistry just the way that we study other things in nature and biology. And we found out what is the commonality. And what we found was really astonishing. There's very small amounts of variance between the shapes, the size, the form of natural unworn teeth. No matter how tall, short, what color you are, or any other race or any other demographic factors. It turns out that just like giraffes, tigers, dogs, and cats, that all of our teeth should look very similar to each other's, and that the principles behind the form in the teeth actually is very minute, the variability. So all we do is we tailor your bite and your teeth and your chewing system within the range of normal that we know works. And it works. And it works for everyone because we know the ranges to stay in. We know what works. And just like in anything else in medicine, if you're getting, let's say, a hip replacement, or if you're getting a tonsillectomy, they know how much tissue is normal, what the ranges of normal are, and they base all of their care and treatment on that basis of normal. So I find that that's the reason why I have a mouthful of bioesthetic dentistry, is because it is simply a rejuvenation of my teeth to the way that they were before they were destroyed by the pathology in my body, my mouth, or even a restoration beyond what I got because of maybe genetic or predispositions to the teeth that actually work in my biology.